Okay, brother, we're rolling. I just want to say on record, appreciate your time, man. You
Yeah.
are definitely someone out there that I would look at and be like, I think you've got more than 24 hours in a day. You know, it's like you do a lot, and I'm going to allow you to have some time to introduce yourself because I don't want to butcher your accolades because it's very academic, and I'm not an academic dude. So I'm going to give you that time, man.
I'll, I'll try to downgrade it. But yeah, I wish there were more than 24 hours in a day. But yeah, my name is Caleb Burgess. I'm a physical therapist in the States. And I'm a physical therapist, also a strength coach. I played basketball in college at a small private school out here called Azusa Pacific University. Played sports all my life. And what got me into the field is getting injured, like a lot of people do when they play sports growing up. I had an elbow fracture in high school, had a pretty prolonged rehab process recovering from that. And I also hurt my knee right before my senior season of basketball, which was horrible timing, but went through some physio with that as well. And I've always been pretty passionate about fitness and sports. So what I do now is I work with patients like the everyday person, weekend warriors, or even people that don't even play sports. But I am pretty passionate about working with people that originally I wanted to work a lot more with athletes, and I still do. But I feel like I've kind of been called to work with people more like the everyday person who is busy but wants to be active, wants to work out,
Mm.
from all different age ranges, and they might not know how to continue to work out when they have aches and pains or injuries they're recovering from. So I would say I specialize in helping people put together like workout programs, training programs where we can help them with whatever issue they're dealing with, but also help them achieve whatever like fitness or training goals they have too
Mm.
simultaneously.
I
That's
love that,
kind of the
man.
thing that I'm the most passionate about. And that's what I feel like most people reach out to me to work with me for. So it's pretty cool.
Yeah, I love that. I love the blending of the two. I think that's really, really important. And I hope that's where the industry kind of goes down, that whole physical therapy scene of like blending the two rather than, we're kind of working against each other. We're now working side by side. I think that's
Yeah.
awesome. And, it's really, really cool to see. And that's something that attracted me towards what you're doing straight away. I'm like, oh, this dude is doing both. It's not a matter of or, it's a matter of and, right? It's like we're going to do this and we're going to
Yeah.
do this because it's going to get you return to play, right? I think that's really, really
Yeah.
fucking awesome.
Thank you.
Yeah, man. So why'd you get into this? Why did you study for a million and one different years? Why do this thing?
Well, yeah, I mentioned earlier, like getting injured and just having positive experiences with my physical therapist when I was younger. And I just always, I remember my dad took me to the gym when I was like 14, 15 years old, wake up at 4 in the morning
Mm.
before school to start lifting weights. And I mean, I'd already been involved in athletics since I was really young, 4 or 5 years old, but the strength conditioning aspect of it started when I was early on in high school. And so I've always kind of been passionate about both things. And so to me, seeing and experiencing what it's like to come back from an injury and having good physios that didn't just stop at the, I guess you could say, it's kind of a gray area here, but they pushed me back to, instead of it looking like rehab,
Mhm.
doing air quotes here, they pushed me back to actually like doing the things that I would need to be doing in my sport, getting me back to my normal workouts so that it blends and it gets to this point where you feel like I'm not really rehabbing anymore. I'm actually preparing to get back. I'm building my confidence back up. I'm building my speed back up. I'm building my strength, my power back up. So that was really cool to go through that. And so that made me more passionate about trying to help other people in that way. And like I said, I don't just see people like that. I see people that work at a desk all day and have neck pain because they don't move. So I
Yeah.
still see those people. And I still see people that like sedentary individuals, which is still cool to help those people too. But I guess the passion, like I said earlier, was about helping people that are active but don't really know how to navigate continuing to stay active while recovering from an injury.
That's a really good point. Of I didn't even think of doing the rehab, right, and then actually getting back to the level that they were at before the injury. There's a bit of a space, right? There's a bit of a gap, and usually athletes are crazy, and they go from, okay, I've just completed my last rehab session, to I'm going full contact, full blown. Let's get me back into this, and then that's usually when you see them again, right? Because they've snapped their shit up once again. That's really interesting, and I can definitely think back of times like that where I'll be like, oh, okay, I've done XYZ. I'm ready to play, coach. Put me in. It's just like, really? Like, you're recovering from a concussion and a neck injury and it's been 2 weeks. I was like, yeah, I'm good, man. I was like, it's probably not wise, but okay.
Yeah. I think what I see a lot of, or what I've seen in the past, and it's not that there's a lot of other great physios that do what I'm doing and probably do it even better, but like, is that there's this gap of, it's like we're used to seeing, a lot of physios are used to seeing so many people where they might be having this like constant discomfort, or they're having this pain with a lot of things they do in daily life, or in their sport their pain comes on pretty quickly, or they have instability in their shoulder or whatever. And they, give me 1 second, sorry about that.
It's all right, man.
So basically they have these issues that are affecting them so much that they really can't get back to much of what they want to do. But then what happens is when they get to the point where, let's say it's a pain problem, and they get to the point where the pain rarely comes on anymore, but it only comes on after playing their sport for a full game, or they're at a certain mile of running and their knee starts to kill them. I feel like a lot of times that is not addressed as well. And in a lot of cases, when it gets to that higher level where the person has a lower amount of like sensitivity or a lower amount of irritability, a lot of times, in my opinion, there's a lot of like strength coaches who could probably do a better job, but at the same time, they might not understand the whole like injury history, medical history background that maybe a physical therapist would understand better. But then the physical therapist might not know how to progress them to the point that they need to get to really excel at their sport like a strength coach could. So I think there's that area where there's this, sometimes someone gets discharged from physical therapy and then they're kind of in this like this land where they don't know where to go, and then they might go to someone else, like they might go to a strength coach, but the strength coach doesn't really, and again, there's some strength coaches that do understand this stuff really well, but a lot of them don't really understand how to take the injury and the pain and stuff into mind when they're getting the person back. And so either there needs to be a better communication between the two professions that are working with that athlete or that person, or we need to educate ourselves to help get them through that gray area.
What advice would you give to a strength coach then, if you've got someone who's just completed rehabilitation and it's not a complete serious injury, but it's, it needs to be looked at with a bit of TLC? What advice would you give them from your perspective?
I think a lot of coaches are really smart and they can help manage this, get the person back. But I think that the general advice I'd give somebody is, if you're a little unsure and you're kind of like find yourself kind of guessing as what's going on, and you're trying to maybe provide regressions here and there, but you're still kind of lost, like don't try to just keep that person to yourself. Like reach out to a physio that is knowledgeable about this area. It doesn't just work with really low level people, but can actually understand how to help you out. And sometimes you can either just ask them questions to see if they can answer some questions for you, and that's maybe all you need. Or sometimes you might need to say like, hey, tell your athlete or the person you're working with, like, hey, maybe go see them a few times a week, get some pointers. And then if that physio and that strength coach can like talk about what's going on and work together, I think that's huge. Because sometimes there's just like little things that you might be missing, that if you just reach out to somebody for some help, and maybe they can just do like an exam and kind of see, oh, you know what, with this exercise, you might want to do this instead. Or maybe here's some other things you can add to part of that. So I think that's what would be helpful for somebody who might need a little bit more assistance with that. But I wouldn't immediately go, oh, I need to talk to a physio. Like you can use your problem solving skills to help someone out if they're not like fresh after injury, for sure. But at the same time, I think sometimes people hold on to people too long, or they think like, oh, I watched these videos or I took these courses and I know how to rehab this person, when it's like, hold on, like we went to we went to school for all these years to specialize in this stuff. So sometimes it's just as simple as asking a few questions, getting a little bit of guidance. And it's
Yeah,
cool to
like
have a referral network to of people you trust.
that's it. That's exactly right. Like I was just about to say, networking is key in this game, right? Like if I put an umbrella statement out there of fitness, right, and all the other little branches underneath it just come under this umbrella of fitness, like it's so important that we talk to people and we just gain a little bit of knowledge from here, there, and everywhere, right? It's
For
hard
sure.
because it's kind of, in my opinion, it's kind of molded itself into this like competitive atmosphere of like, no, I'm going to try and keep as much of my people away from you, and you're going to do the same. It's
Yeah,
like, oh, guys, like if we like work together, like the whole thing, the whole game could elevate, and then also our own game, our own little niche games could then elevate too.
for sure. And I, just to kind of add on that, I have some connections with some strength coaches and personal trainers where it's at the level where if they have somebody who's having a nagging injury and they're trying to help them provide the regressions needed, time off, deloads, whatever, but the person still it's not really getting better, they don't even hesitate, and they send me an email and say, hey, here's this client, and they CC them in the email, and I start working with that person. And majority of those people still continue to work with the trainer, but they're also seeing me to fill in the gaps.
Mhm.
Sometimes they'll take a break from that, and he's not even worried, or the ones that I work with, they're not even worried that I'm going to take this person. I still am going to try to work on some of the same stuff they've been working on with the trainer, but like it's going to be, I'm going to obviously take my physio brain and apply that more. And then a lot of times I have no issue with it either. When they feel like they don't really need me as much anymore, they'll go back to him. And so it's just kind of this symbiotic relationship that's helpful. And it's cool because I get clients and I get business and I can help people, but at the same time, he knows, okay, this person is not making progress, and they're probably not going to be happy if they keep hurting themselves. So let's have them take care of, and they'll come back and be ready to go.
100%.
That's
Like,
pretty cool.
you know, like a lot of the time people get mixed up of, oh, we're fighting over 100 people that are super into sport, and we're trying to, you know, get the business out of these people. It's like there's nearly 8 billion people on the planet. That's your
Yeah.
pool of people that we're trying to help. You know, like it doesn't matter about the national level netballer that might have banged up a knee and needs to go see Caleb for 4 weeks. It's like if
Yeah.
your heart is really in the right place, or if you really want to help this person as much as you can, sometimes that means referring on.
Yeah. And I guess to widen the net here, there's been plenty of people that I've seen who consult with me, and I think that they need to see an orthopedic physician or a surgeon. And not because I'm saying they need surgery, but just because I'm like, hey, you need some sort of medical management, or they need to rule some things out,
Mm-hmm.
or your symptoms sound like something a lot more serious that I will not be able to help you with that well. You should
Mm-hmm.
see a physician, right? And then some of those people, they never work with me ever again, but I'll get a message in like 3 months saying, oh my God, I'm so happy that you referred me to this physician, because now like we found out that I had this problem that was like really serious. We had to take care of it, and everything's good now. Or I'm glad you sent me to them because they provided some sort of medical management to kind of calm things down, whether it be an injection, whatever. And now I'm back to working out, and maybe that's all I needed to at that time. But at that time, they were so flared up that there's no way I could have done much with them because there's something that needed to be medically managed. So I think it's cool that we have these people that we can refer to, but you got to make sure you find the right people to refer to
Yeah.
that trust you and aren't just in it for like taking someone for financial gain, which is obviously unethical.
Yeah, totally. So going like turning the page onto like general population, what do you
Yeah.
see as like the biggest barriers in like the normal lifestyle of the general population at the moment, i.e. sat down all day and not the most physically active human beings? Like what do you see coming through the door? How would you advise I know it's hard being a blanket statement, but what would you advise
Yeah.
people to do and how to manage that lifestyle?
Yeah. I see that a lot. And from the people that I see in my own experience, I just think giving advice to people that are, let's say they're working a job on the computer, it's so easy to get so focused on a project or whatever that you don't realize you're spending 3 to 4 hours just sitting on the computer. And it sounds like the most like basic advice, but I just tell a lot of people like, hey, get up and move. There's not like a specific time frame. I might say get up and move every 20, 30 minutes. But a lot of times I'll ask somebody like, hey, do you notice that you might start feeling stiff or start getting some pain at a certain amount of time? And if they do, I say like, okay, like cut 5, 10, 15 minutes off of that and get up and move around before that starts happening. And sometimes people say like, oh, well, if I'm really focused, I don't want to do that. Just give it like 1 minute, 2 minutes, just get up, do some sort of stretching in a way that you haven't moved. It doesn't have to be stretching, it'd be movement, any sort of movement, or get up and go on a little walk or whatever. And just those little tiny things can go a long way. And it's I honestly think it's more beneficial for those people. We're talking about people with like maybe back or neck pain or like that kind of general upper back neck discomfort, tightness feelings. A lot of times all you need to do is get up and move and do it often. If you're trying to do like a 30-minute routine in the middle of the day, but the rest of the day you're just sitting around doing nothing, I'd rather you spend like 1-2 minutes every hour, every 30 minutes, just doing a few little things rather than spending just this time on your lunch break when the rest of the day you're just sitting around not moving. Or that could be standing around not moving too. So I think if we just get more movement throughout the day, more higher frequency, even though it might be like little tiny chunks, I think that's beneficial.
What are you seeing like the differences in like human adaptation from sitting down all day? Like, have you noticed any change
From when?
from, obviously you've got the whole, we're playing cards of 100 years ago or so on and so
Oh,
forth. But like, you
yeah.
get people that are laboring all day, right? And they might come in, you're like, okay, you've got this and this issue. And now you've got people that are like on a laptop all day. That's pretty difficult from my perspective. Obviously, I'm not in your shoes, but from my perspective, that's pretty difficult to be able to work around, because you're like, okay, well, you're like glued to this chair. How do I help them?
Yeah. Are you saying like differences in how people like the things they present with, like
Yeah,
mobility issues, specific mobility issues, strength issues, things like that?
yeah.
I mean, yeah. So I mean, when it comes to like just like we're talking about like not necessarily pain, but talking about like mobility issues, I think a huge thing that a lot of us are aware of is like lack of thoracic mobility, thoracic spine mobility. Um, and it's not even that the hunching over necessarily by itself is the problem. It's that they're hunching over, but they're not like moving out of that. So I'll admit, I hunch over sometimes when I'm on the computer and the laptop, and I mean, it's comfortable to me, but I also will spend time putting my hands behind my head, kind of opening up, reaching overhead, twisting, just naturally. I just train myself to move often. It
Mm-hmm.
doesn't really give me issues, but most people don't think about that stuff. So when you check their shoulder function, how their shoulder blades move, their actual shoulder joints, and their thoracic spine can't move, and it's all kind of connected. Their shoulder mobility is usually pretty poor. Thoracic spine mobility is usually pretty poor. Scapular mobility is usually pretty poor. Um, and then, I mean, you could even bring it down to hip mobility as well. A lot of times people don't have great hip mobility into like hip extension. So being able to bring their leg behind them. Those are some of the big things from a mobility standpoint for those types of individuals,
Mm.
because they're just always getting into the same positions and they're not really moving out of those positions very often.
Mm. If you were to change one thing, like one perception on in people's minds, right, in this whole field, what would you try and break? What would it be?
Which field are we talking about?
Talking about like, fitness, rehabilitation.
One thing, ooh, that's a tough question because there's a few things. But I think one thing, and I don't know who you follow online or who who you're listening to. I guess it just depends. But I think there's way too much emphasis on trying to put people into a box as to like what's the correct way and the incorrect way to move. And we're talking about from like we're talking about like more from like a pain aspect. I think people think, oh, if you move this way, you're going to have pain, or if you do an exercise this way, it's going to cause injury, which it's not that clear cut. I know when we're talking about just like straight biomechanics and performance and how much weight you can lift, like, of course, we have to like listen to physics on that kind of stuff. But also, when we're not just talking about specific lifts and how much weight you can lift, we're talking about like life and things you have to do in your life and specific tasks you have to perform. Like, everybody's going to have to move a little bit differently. We're all shaped a little bit differently. We all have like different joint structure. We're different sizes, different limb lengths. So we're going to have variability to a degree. Now, obviously, if you're looking at somebody move and it just looks like your eyes are like, you look at them and your eyes are bleeding because they're like, it's not efficient.
Yeah.
They're just, yeah, it's like, and it's just all over the place. And yeah, of course, like you probably want to fix that or try to improve how they're moving with some simple cues. But I'm not going to like take out my measurement tool and like look at all the little millimeters of change and how they move from person to person. It's like, if you're feeling good and you're doing it and it's within the realm of what I think is functional for you, I'm not gonna split hairs. Now, you also have to understand that there are some people that have sensitivity to specific loads and positions of different areas of their body, where I might be a lot more detailed with those people in certain cases, not because I'm saying one way is right or wrong, but because of in their current experience or their current predicament that they're in, if they, for example, I'm going to use like deadlifting as an example. If they don't round their back as much for that specific person at that time, they might feel better. Somebody else, and this is kind of weird, sometimes people will actually feel better if you let them round a little bit more, right? Because they're overarching in certain things. Like I had an Olympic weightlifter in her 50s who she was always told, like, from all our coaches, like, you got to arch hard, like whenever you're doing any sort of Olympic lift. But she was like overarching like crazy, like all the time. And I had to teach her how to like not do that. And she's like, I literally feel like my back is caving over rounding. And I'm like, no, it's not even close to doing that.
Yeah,
and she felt a lot better when we didn't do that. So it really has to be very specific to the person. And one thing that kind of it bugs me a little bit sometimes is on the other side of the coin, the people that are basically saying the same thing that I'm saying, that we don't need to be so much of a stickler about how people move like correctly or not correctly. Sometimes that message can get lost into that those people are saying like, move however the hell you want, doesn't really matter. And to me, I'm like, we have to kind of provide that nuance, where we're saying like, hey, in the general population, everybody, we can't make these black and white rules for everybody. You just can't do it. It just doesn't work. But when you have the one person in front of you who has a specific issue, whether it be performance, pain, or a combination of both, like tweaking how someone moves to make it more optimal for them at that specific time is totally relevant and always will be relevant. So I think we need to provide more nuance there. People tend to take one side of the coin and say like, no, we have to be so black and white about it. And other people say like, it doesn't really matter as much. We don't even worry about it. It's like, well, we can kind of look at both, and that kind of drives me crazy sometimes, that we have to get in these camps and like bicker at each other. Like, it's not really that simple.
It's funny, right? Because there's a reason why both sides exist, because they both fucking work. There's a reason why all these different rehabilitation processes work, because they all are there because they all work. It doesn't make any sense how you throw all your chips in one basket and be like, everyone needs to do this. Because like you said, everyone's different, right? Everyone's different body lengths, different backgrounds, different injuries, different everything. I'm really glad that you said that as a point. Like I can think back and flicker through all the places that I've coached in and all the years and all that type of shit and be like, there's so many different body types that walk into the gym. And I've got a coach in the same thing, right? The movements don't change. And I'm like, oh, wow, okay. How am I supposed to adapt the way I'm coaching and what I'm saying and how I'm going to get this individual to move. So obviously they do it safely, correctly, and get everything that they can out of it, right? And yeah, you've just got to teach the movement and coach the individual, right? Like coaching is where the art form comes in. Teaching is like reading from a fucking textbook. It's simple.
Yeah.
It's like the movements ain't going to change. You know, a deadlift is a deadlift.
Yeah.
You're picking an object up from the floor and you're putting it down. You know, an overhead press is the same, like, but the people are different, and then the way they move, like day to day, week to week, might change too, right? And that poses a lot of issues with like aging too, like the older population. That's a really interesting population to dive into. Like, I think if you can coach the older population and coach the younger population, like you can pretty much coach anyone.
Yeah, it takes a lot of skill and experience to know how to best do that. And I think with a lot of like lift, when you're training lifts and stuff, it's like there's obviously guidelines as to, like, you can't just let someone just do whatever the hell they want and then go like, oh, we're going to kind of tweak this a little bit. It's like you're if someone's never been in the gym, you're going to teach them a certain way to do it. But then you watch them perform it and they might not look like you, but you recognize, okay, how can I make this optimal for them? It might not look like it does in a textbook because it's a different person, but I'm still giving them initially maybe the similar cues to begin with, and then you tweak that. You don't just completely deviate all the way into left field with it, but you still you tweak it slightly off of that center line to whatever is best for them.
So important.
I've had plenty of people that I work with where I have like video instruction of me doing it, and I go, they're trying to force themselves to look like me, and they're like, it's so uncomfortable. And I look at them doing it, I'm like, that looks so awkward. I'm like, why don't you try doing this? Because on this test, your hamstring flexibility is way more than mine, or it's way less than mine, or whatever. So here's what you should do instead. And then they try that thing and like, oh, I feel so much better. And I'm like, yeah, it still looks good. It just doesn't look like me because I'm me, you know? So
I'm really glad you said that. And if they don't pick anything else from this conversation, I hope they just pick that from it. You know what I mean? As picture what you want it to look like and then adapt it to the individual in front of you. Like things are going to have to change ever so slightly. And I think that's the beauty of coaching. I think that's the beauty of this whole entire industry, right? Because you've got to be like Sherlock Holmes. You got to be able to like try and figure out the little, they're saying it doesn't feel that right and it looks slightly off, right? And if it looks slightly off, it usually is off, and you just got to be able to decipher what's going on. And I think that's where the fun begins, right? If everything was just simple and easy and come in and, okay, I want you to squat like this, and then everyone just copies and it's all exactly the same, it'd get boring, man.
Yeah. And then you play into when you go into the whole pain aspect, when you're physio and working with people every single day with pain, is you come in with these people that have these fears of movement. You need to figure out, how am I going to get this person to become less fearful? And that fear can actually increase their pain experience, not because they're actually like putting their tissue on more load or their mechanics are off as much. It's just that they are so scared that something's going to happen, or they've read really poor information. They've been told really poor information, or they've been told something that's actually not bad information, but they deciphered it completely differently than how the person meant it. And so then they come in and you're like, man, they're scared to death to bend over and pick something off the ground. And it's been like 8 months and they hurt, like they can, normally you should be able to do that within a month or two at the most, right? But this person's like, just, they look like as stiff as a board when they're going down. Yeah, their back's flat. Yeah, they're hip hinging, but they cannot round their spine at all because they're scared to death that they're going to slip a disc or whatever they've been told, you know? So then it becomes more this, like, you are trying to expose them and desensitize them and train them how to not fear movement, which is a completely different ball game, right? So that's a whole nother can of worms. But sometimes it's a combination of both. You're trying to improve someone's performance, but you're also trying to help retrain their brain in a healthy manner where they're not so scared that they're always going to get injured.
How would you get around those psychological barriers?
So that's very individualistic as well. But usually you just have to talk to the person, and it doesn't happen day one all the time. Like sometimes this stuff gets uncovered like a month in, a couple months in. Hopefully it's sooner rather than later. But a lot of it is just trying to meet the person where they're at and kind of understand how you can explain things in a way that they will understand. And you'll strike out a lot of times. But the more you do it, the more you find like metaphors that'll work, things that you can show them. You might find resources they can read. There's a lot of good stuff online. There's some really good YouTube videos I have people watch. It has like anecdotal experiences from patients that were like in a similar boat. And I can remember those and go, hey, watch this. Like I can tell you this till I'm blue in the face, but if you watch someone else who's actually been through it, that's super powerful too. And I can think of like 5 people right now off the top of my head who literally like they have them fill out like review forms like every week, every month to people that I work with online, just to kind of check in to see how they're doing. And like a couple of them, like literally their entire review form was like, it wasn't even about me getting them stronger or better shape, whatever. It was like, thank you for changing the way that I viewed myself. Like I feel so much more, like if I get hurt or I have little injuries here and there, like little flare-ups here and there, I'm not like freaking out anymore. I know my body's going to heal. I know it's not that big of a deal. I know how to manage things. I know how to modify my movements while my body's healing, and I'm not losing sleep over it. And it's like, it's weird because it sounds like, well, they're still like getting hurt from time to time, but I'm like, yeah, but this person has been dealing with this for a long time, and so for them to actually not be freaking out and to bounce back really quick is like huge. It's like a game changer for them. Because I think a lot of times what we don't recognize is that like when you're somebody who's like worked out, lifted, played sports or whatever, we are so used to having little aches and pains here and there that we just kind of ignore, or we just kind of go like, my back's a little, I tweaked my back today. It's all right. Yep. Like I'll go to the gym tomorrow. Like, you know what I'm saying? Like yep. It hurts. Like I'll lift a little less weight, whatever. I'm going to avoid that one. And we're so used to that it's hard for us to imagine people who the same thing happens to them and they're in a bed for 2 weeks, or they're like, I'm not going to the gym anymore because my back is screwed up now. And people don't recognize it. There are people that they might have higher anxiety. They might have issues with that, or they might have like a relative who has had spine surgery or shoulder surgery and they had a horrible outcome, and they're like, I don't want to be stuck in a wheelchair. I don't want to not be able to lift overhead anymore. And so they have all these thoughts in their mind that you have no idea about. And you kind of have to help them work through that stuff and help them understand things and help them understand what information they read online is poor information, what's good information, and what the research shows. And so I think the more you work with people, you see that there's people that are totally different than maybe like a lot of us who work in this field are, which is we all deal with aches and pains too. But to us, we just like kind of like brush it off. Usually, sometimes it can be a lot worse. But usually, we just kind of brush it off. Like, it'll go away. Like, just give it time. You know.
Yeah, that's why sport as a kid is really important, right? You get to kind of decipher those codes that your body's telling you and be like, well, that's a minor thing. Don't worry about it. And oh shit, that's getting a little bit, towards the line now. I need to start paying that a little bit more attention and maybe take the foot off the gas a little bit more. And what blows my mind is when, athletes come in and who haven't been an athlete before and never ever worked out or done anything. You're like, oh, okay, how am I supposed to be able to, portray what we're supposed to be doing? And hey, this is going to be uncomfortable, right? But it's not going to kill you. Don't worry.
It's true. I had a lady in her, I still remember this. She was in her mid 50s and she came in and she was having like thigh pain is what she said. And we were doing like step ups or something some way through the exam. And she's like, oh, that's my pain. It's killing my thighs. And I ended up finding out it was just the fact that she was getting a pump, like a quad burn from doing the exercise, but she had no idea what that felt like because her entire life was like it was funny because she was in actually decent shape. She wasn't like overweight or anything, but she just had always lived this life where she really never had like pushed herself from an exercise standpoint. And like her life was just like going to the store here and there, like hanging out with friends. She didn't go on hikes or anything. So she had no idea what it felt like for her legs to burn. and I tried not to laugh, and I just
Yeah.
explained to her, like, that's okay. That's just your muscles working, and not you're not injuring yourself.
Wow. And then you get the other side, right? You get those athletes that are just crazy and have done
Yeah.
so much sport or whatever. You're like, how you doing? Oh yeah, I'm fine. And the next thing you know, they collapse because they've
Yeah.
just told
Oh
everything
yeah.
inside of them to behave. And they're the people you've
Yeah.
got to keep an eye on, right?
Yeah. But both are difficult because the people that are afraid to do anything or any side of pain, they'll clam up. Those people, obviously, it's a lot of work to kind of help them like understand how much is okay, and it's okay to have some discomfort from time to time. And then, like you said, like there's the athletes where you're like, you constantly are pulling on the reins, like, come on, like get back here. Like you can't just ignore that. Like when
Yeah.
they're actually having pain, that's not necessarily like an okay thing,
Yeah.
but they've always been told like push through, and
Yeah.
they watch all these motivational videos and they imagine themselves in those motivational videos, and they want to just run through a wall, and you have to like explain to them like, this is not, we don't want to push through this. This is your body's trying to tell you you need to back off.
Yeah. That's
So
so funny, man.
that's super interesting too.
That's
Yeah.
that's me in a nutshell. Like everything
Yeah,
that you
that's a
just
lot of
said,
us.
I've done it, man. Like it's so
Yeah.
funny. Like me and a mate of mine just recently did a charity event, right? Where you know the CrossFit workout Murph.
Yeah.
Yeah, well, we did it for 24 hours for charity, right? As you do, just no problem. And I had to. There's a guy next door. Luckily, he was working next door and living next door. Like he was a nurse, right? And I had to get his medical advice because I was going pretty hard anyway. I couldn't cool down. Like me being northern in like southern hemisphere heat is not a good time anyway. But I couldn't cool down, and my heart rate was at fucking crazy. Like I was doing an air squat every like 10 seconds, and I could feel the heart rate just bursting through the weight vest. And I was just like, look, man, like I've never had a problem with my heart. I've had pretty much every injury under the sun, and I can't bring this thing down. And I sat down for 50 minutes, and my heart rate was still at 110. And I was like, look, dude, I don't know what's going on here. And I'm definitely one of those crazy motherfuckers that I will seek out medical advice, and I'll be like, give me your medical opinion, because I'm not going to take my opinion, because my opinion would just say, shut up and keep going.
Yeah.
Right.
Yeah.
And then I would collapse, and then I would have a bigger problem at hand. So it's like, well,
Yeah.
I need your medical opinion, right? Give me the facts, and then I'm a big boy. I can make my decision on my own, but give me the goddamn facts first. Yeah, those
Yes.
people, those people are definitely a pain in the ass.
First-hand experience. Yeah.
Yeah.
And it's funny, this is kind of a tangent off of that again though, and this is again talking about how people take camps, right? Especially people that are like putting out content information online, is that I see, I'm not saying I do everything right. I make mistakes too, but I feel like there's a lot of people who, if they work with primarily higher level athletes, and they know that their personality is to push through things and to kind of ignore pains and stuff, a lot of times they'll preach this message of like, you should not be having pain, everything should be pain free. And like, which for those individuals, usually that really is going to help them, because they need to learn that they need to listen to their body. But what happens is they don't realize a lot of times these people that spread this message, it's getting out to other people that aren't those super high level athletes, that when they have any sort of pain, they're like, oh shoot, this is what's happening, and they freak out over it when it's maybe just little aches and pains that are not that big of a deal. Mm-hmm. So that they might spread that message, and then there's other people that might only work from the physio aspect. Might be people that only work with these like very chronic, persistent pain patients or clients who just want to get their life back, and it's taken over their entire life. And they're kind of preaching like, hey, you need to like, we need to get you starting to move more. Like it's okay to push through or push into your pain a little bit to help get you back to life. But then they forget that there's all these other people on the other end of the spectrum that are going to take that to mean like, oh, I can do whatever I want. Like, let's do it. So you always have to provide nuance, right? Because you're going to have different ends of the spectrum. And then each kind of bicker at each other when it's like, well, maybe with your patient population that works, or with your patient population that works. But if you're that person working with those persistent pain patients, and then you had this like world-class power lifter come in who's just completely barreling through stuff, you probably should tell that guy to like try to keep things relatively pain-free or as pain-free as possible. And then the reverse is true as well.
Yeah, context is so important when it comes to this thing. And what really blows my mind is like overcompensating, right? Like usually they're on one side of the spectrum and we want them to be a little bit more centralized. So then we'll coach the other side of the spectrum. So then they kind of like come back to the middle, right? Because if we go, say, for example, we use like a squat analogy, they're squatting on their toes, and we say, oh, we want to squat in the midfoot. Most people have no idea what that means and what that feels like. And then they'll just kind of drift back ever so slightly. So then you're like, okay, put your weight in your heels. And the next thing you know, they're like halfway, because if they put the weight in the heels, they're going to fall backwards, right? It's funny because you're like, if you take what I'm telling you to do at face value, it would still be wrong. I want you to kind of take that direction and then just kind of come to the middle of it.
Yeah.
It's funny, man.
True.
There's little manipulation things that you do for patients, for clients, for athletes. It's really funny. I think the whole game and the art form of coaching is fascinating, man.
Yeah, I think a lot of it, just a huge part of it, you need to be solid on your foundational skills as far as like how you program, how you, and then like from a physio aspect, how you treat, like how you train movement and how you can manipulate movement. That's all important. But I think if you can't communicate really well with the person that's in front of you, you could be like the genius at about everything else, but you still won't be that great if you can't communicate well with people. So that's why you'll see coaches or physios or whatever who sometimes aren't that great with a lot of the technical stuff, but if they can connect with people really well, they can still do a really good job helping people. Not that they're completely like they have a baseline understanding of how to help them from like that, all that technical stuff. They're not just winging it, but at the same time, if they can connect, they do really well. And then sometimes you see these people that are absolutely brilliant and they teach courses to other trainers or other physios or whatever. They're brilliant people and they can articulate information very well. But then when it comes to communicating, if they're like a robot with people, it's going to be really hard to help people in everyday life in the world. So
it's like
having that combination is huge.
Yeah, for sure. It's the difference between the art form and the academia, right? Like everyone can kind of, well, not everyone, I take that back. Like not everyone can sit down and learn in depth of all this like knowledge. And I'm definitely not that guy. Like I wouldn't make it through like an undergrad, master's or PhD. Like that's just not the way I learn. And then on the other side, it's like the art form of being able to communicate it. You can't really define it. It kind of changes. It's like art, but with the human canvas. And I think it's really important to be able to, it goes back to that networking and referral base, right? It's like, I'm going to go seek out people who have more knowledge than myself, i.e. yourself, right? And then I'm like, okay, cool. I'm going to then add some skills and experience along the way that I've picked up to then be able to adapt it to the individual in front of me and then do the same thing and the same thing and same thing as the person changes. And I think, like you said, I think having both is really, really important. I don't think you can throw your chips in one side and be like, I'm only academic, because if you can't communicate it, you're fucked. Or if I'm only like an art form, it's like, well, if you don't know what you're talking about, again, like, dude,
you can connect with people, but you're treating or you're working on the completely wrong thing, even though that person likes you. Great.
Yeah.
And I have had patients that have come to me who are in love with their past physio or whatever. But then when they tell me what they're doing, I was like, what the hell? Like, why were you working on that stuff for 5 months? Like, what? Yeah. But they're like, I love them. Like we're like family now. But then on the other side, like you said, I have people that are like, when they tell me what they were doing with their physio, and I'm like, oh, that sounds like a great program. But the person like hates that physio because they were a jackass. You know what I'm saying? Like they were just they just did not connect with them and they didn't care. And they're just like, this is what you got to do. You just got to do it. And so it's you're right. You got to be able to balance the two for sure.
Yeah. Like I've had some stories, people coming to me, oh yeah, I love this guy, I go see him every week. Like, how long have you been seeing him? Like 8 months. I was like, okay, what have you been doing? Oh, the same stuff. I was like, has it got any better? No. I'm like, I'm not a rocket
Exactly.
scientist here, man. You know, like you're more educated than I am, but come on, this seems pretty dumb.
Yeah.
It's not
Yeah.
got any better, man. Like it seems like a pretty good money making scheme from that physio's perspective. You know?
Yeah. It's yeah, that can be definitely frustrating. And then that's when someone has a really good really good relationship with somebody. That's great, but sometimes it's also hard to provide your opinion or your expertise when they just meet you,
Yeah.
because they don't trust you on the same level as that person they've this amazing connection with. But
Mm.
you're trying, but you kind of have to like beat around the bush as to how to help them
Yeah.
and
Why they're
provide that
now.
information without stepping on anybody's toes.
Yeah. You've got to tell them
That's
that
an art form too.
their friend, someone that they've now got a friend is speaking out their ass. You're like,
Yeah,
well,
and
they don't.
I won't even lie. I mean, I've had people that see me, and I could just tell we're not going to connect very well. Like
Yeah,
just
yeah, yeah.
their personality, like I can't get through to them, and I can just tell that my personality just doesn't click, or I might even annoy them. I'm trying hard to like to match them and their communication style, but I know I might have a friend or something who's totally going to click. So I might even tell them like, hey, you should go see this person because they're also really good.
Yeah,
But I think you'll enjoy your time
yeah.
much better with that person versus me.
Nip it in the
So
bud real early. Yeah,
yeah,
and
that's a big ego check on that one. But you kind of have to like you have to recognize when it's just not really a right fit.
yeah, that's really respectful too, though, right? Like if, say for example, I was your client and came in and you said that to me, like, yeah, okay, like it might be a little bit harsh to start off with, but you'd look back in hindsight and be like, you know what, I actually really respect that person because they didn't allow it to kind of blossom into conflict. They're just like, hey, I'm gonna nip this in the bud real quick, and then I kind of get a better service from someone else, and that's a very respectful thing to do.
Yeah, it's not easy. Don't get me
No,
wrong. He's like, you want to help everybody, but
yeah,
so I wouldn't say it's day one. Normally, it's usually like after a few visits, and you can just tell it's not really working out very well.
mm-hmm.
And you can just tell. And a lot of times, it's even life experiences. Like they just have all these things to talk about. You have no clue what they're talking about, and they want to connect with you. And you're like, this person here has the exact same or very close. Like, and I know they treat well. I know they coach well. So like, please, like, let's see them for one visit. See how you like it, and I will
Agreed.
not get offended. I promise.
Agreed. I got three questions, right?
Sure.
I like to end on three questions. So I'm really interested on your perspective of these. Number one, what's the greatest piece of life advice you've ever received?
That's a hard one. Um, I guess at the top of my head, and this could probably change from time to time, but I think and this might sound kind of cheesy, but I think people forget that you never know when it's your time. You never know when your time's going to end on this world. So um, like career success is super important. Trying to like um, be successful in your passion is important, but also you need to be able to enjoy your life with your friends, your family, your loved ones, experience the things that you want to experience when you can. Don't be stupid about it and do too much of one thing. Have a balance. But I think like trying to every single year make it a great year, and rather than I'm working towards something in the future only, you
Mm,
still need to stop and kind of live in the now. I mean, that sounds so cheesy, I know, but like that helps me a lot. And I think sometimes I'll get too caught up in this, so focused on um, helping people or my job, and then you kind of have to take a step back and go like, man, I got to take time for myself, for my family, for doing just relaxing and doing the fun things.
mm.
In my life, that's something that I have to kind of manage. Other people might be completely different, but that's what helps me out. Hopefully it helps some people out to hear that.
I think it's important, especially in Western culture, right? With the whole hustle culture that's kind
Yeah.
of, been brought up. Everyone's just like work until you die and that's it.
Yeah.
And if we only get one shot here, then do we want to spend 24/7 just doing something and grinding towards something that's that's in the future. We never actually get to touch it. I'm like, Buddha ends up saying happiness is the journey, not the destination, right? And maybe we need
Totally.
to think about that a bit more.
Yeah. And I mean, I don't want to be, I can't think of the right word, but I don't want to act like my situation is a tough situation. Like I do something that I love every day, and a lot of people don't, and they don't have a choice, right? So I'm not saying like quit your job and do something you love. Like if you have something that you have to do and you have to put food on the table and you got to do it, like you got to do it. If you can do something that you actually love to do too, that's a plus, because you can kind of enjoy. But even in that, you can still work too hard and not realize that you're not taking care of yourself enough or other things in your life. So
100% agreed. Question number 2 is, what's the worst piece of life advice you ever received?
Man, I don't even know. I would need to think. I'm really bad about getting put on the spot. I'm sorry.
Oh, I'm sorry, man.
Worst piece of life advice. I don't know. I'm a pretty optimistic guy, so I might need to pass on that. I don't even know.
Wow.
I don't know if I've had, either I totally ignored it and just threw it out of my head, or I just can't think of it on the spot. I'm sorry.
No. Don't apologize for not remembering bad advice. That's a positive.
I mean, the first one I could remember because I just heard that from, I think when you work with so many people, especially when you work with people as they get a little older, you hear that a lot from people. It's like, hey, enjoy your life, enjoy your family, enjoy these things, because like you're gonna blink and you're gonna be my age. And like I'm counting down my years now. Like these are some of my older patients I work with, and it's like I'm like, wow, you don't think about that when you're in your 30s. Like I don't ever think about that, but like, yeah, I'm gonna be there one day. I don't want to like think about like, oh, I wish I would have done all these things. Like I want to be able to enjoy my life every year when I can. So that's easy to remember. But the bad information, I don't know. I might have just thrown it out.
Good. That's a good thing, though. Last one. 3 words you tell your younger self.
3 words I tell my younger self. I don't know if I can keep it to 3 words, but I think I would say, I won't keep it to 3 words. I'm sorry. I'm just going to do a sentence. I think I would just tell myself that every time you feel like you learn something or you know what you're talking about, you'll probably look back at your former self and laugh in another year. so every time you feel like you got it figured out, you don't really have it figured out. But and then kind of taking every day to realize that once I feel like I got this, I got to remember that I probably don't, and there's always a way that I can improve. And I will look back and realize I didn't know as much as I thought I did. I might completely change my mind. And I think that directly applies to my profession and my career, because I look back, I try to reflect on things every once in a while and go, man, I can't believe I said that. I can't believe I used to think that. Or I think the message was clear, but I didn't say that in the right way. Probably should have said it this way, now that I know more. So it's kind of one of those things. I think the quote is like, if you know better, I'm butchering this, if you know better, do better, or something like that. And so you do your best, but once you know better, you do better. You don't just like take that information, ignore it. You keep finding new information to do better and changing yourself, and not accepting what you already know. That was not 3 words, but I think it's beneficial.
It's close enough, maybe 4 words.
Yeah. Know better, do better.
Know better, do better. Yeah, man. Like, the only constant in life is change, and that just like elicits to growth. And I think that's what we should all be striving for, right? You get to learn from your past self, which is a very strange concept. But if you've got a growth mindset and an open mind, like you can end up doing that. And I think that's the thing that we need, right? Just being able to look at something with an open mind rather than sitting in those camps, like we said before. And no, this is the only way you can do things. I'm like, oh, fuck's sake, here we go. Okay.
Yeah. I think one last thing to add to that I didn't mention earlier is, and this helps me a lot, is like trying to understand that if you don't agree with somebody or you don't understand their perspective, like if you actually try to empathize and put yourself in their shoes and try to see it from their side, most people have a good reason for believing what they believe, even if in your mind you're like, wow, you're an idiot. Why would you think that? Right? But if you actually think about it from their side, they're not trying to be an idiot in your eyes. They actually believe what they're saying is right. So if you try to understand why do they believe that that's true, they have a good reason for it. Most people aren't stupid, right? They actually have a reason for believing that. And if you can connect with people on that level and help them understand that you get why they think that way, you might disagree with them, but you don't think they're stupid. You can see why. Oh, that makes sense. You believe this, what you believe. I think you can connect with, not just on like from a professional standpoint, but just in life. I think that really helps. And it's something that I'm always trying to remind myself when I'm interacting with people.
That's a really, really important point, and I'm really glad that's the last thing people are going to take away. So thank you, brother.
No problem.
I appreciate your time, man. And if you're ever knocking around, you know, in the bottom right-hand corner of the world, you know where I am. So hit me up.
Someday.
We'll grab a coffee.
For sure.
Yeah, man.
Thanks.
All right. Appreciate your time, brother, and appreciate everything you do.
Awesome. Thanks,
Thank you, man. Take it easy.
Thanks.